So as we would expect to hear tomorrow when the conference gets underway, health experts have been saying for a long time now that the COVID-19 pandemic had a serious impact on progress towards the UN AIDS targets of 2030. Now, to remind you, that goal is to end the HIV/AIDS epidemic as a public health threat. That means in the next 7 years. So how far back have we been set because of COVID-19, or is it really just an excuse for having lost focus on it? Well, let's get the thoughts now with the conference co-chair. That's Dr. Gloria Maimela making time for me this afternoon. Doctor, good afternoon to you, and I appreciate your time. I see you smiling as well, because I did want to talk to you and find out a lot was blamed on COVID-19. One of those was the lack of focus in fighting HIV/AIDS. Is that a sentiment you agree with?
Gareth, and good afternoon to the viewers. Certainly, before COVID-19, South Africa was on track towards reaching the UN AIDS 2030 targets. Comes COVID-19 pandemic, suddenly we got derailed. Suddenly with lockdown, COVID-19 lockdown, people on the ground could not access testing services. People at high risk of HIV infection, including adolescent girls and young women, suddenly could not access prevention services. People on ART, people already on treatment, could not access treatment, and hence ended up with having rebound viral loads where they could not be suppressed simply because they were not accessing treatment. So definitely COVID-19 derailed the focus on HIV/AIDS.
I don't mean to ask an overly simplistic question, Doctor. You're the expert here, so please correct me, as I imagine you will. If I were to use the example that COVID lasted, let's say, 3 years, the worst of it, or the most of it, 3 years. It's not gone, I understand that, but the worst of it in our country was about between 2 and 3 years. Does that mean we're 2-3 years set back in our fight against HIV/AIDS? Can we measure it like that?
Probably so, because with COVID-19 came the opportunity to implement some of the innovations to leap forward. For example, we started then using technology to restore access to care, and by doing that, then we're able to reach more people than we ever did before. So in fact, it forced us to go back to the drawing board to figure out other strategies to reach people living with HIV and provide access to care. So yes, we took 2 steps backward, but I think that with that, we still managed to go forward. And I believe that if we keep focused, if we will certainly get back on track towards 2030 targets by UN AIDS.
Unpack the theme for this year, just for viewers who missed it when I was busy saying hello to you. Act, connect, and end the epidemic. I think end the epidemic, you have just explained very nicely what the goal is there, at least on track to hit that goal. Act and connect, what's the importance of that? Help me understand.
So what we are saying by this theme is that the time has come to act now. We want concrete action towards ending the epidemic. We're also using this as an opportunity to connect. You will remember the last conference was held in person in 2019 before the epidemic. And now this is an opportunity post-pandemic for people to gather under the same roof, connect, collaborate, and come up with concrete solutions towards ending the epidemic in 2030.
What is the one thing at the end of this conference, Doctor, that you would like to have drummed home into the delegates and those who will be watching around the world? Because part of the discussions I've had in the build-up to this, and I seem to have the same conversation every year, is HIV education in schools. A couple of years ago, it was a bit taboo about having conversations with people deemed too young. But if you look at our HIV/AIDS infection rates in this country and the ages, no young, in my mind, is too young. What would you like to take one thing away from this conference for someone watching?
Absolutely. The one key message is that we can no longer afford to wait. We can no longer afford to ignore the fact that HIV transmission is ongoing and that our adolescent girls and young women are mostly affected by the virus. So we have to discuss HIV. We have to bring it to the table. We have to come up with solutions to towards ending this epidemic. So the one key message is that we need to face this epidemic once and for all and put it to bed. We need to make sure that all the tools that we have, and Gareth, we have many tools. The science is far advanced as far as HIV is concerned. So why are we still grappling with this epidemic today? So we need to unpack those tools. We need to make sure that at the end of the conference, we have clear steps in terms of how to put this epidemic to bed. What we know, we have, for example, long-acting injectables that have come up. We want steps in terms of how soon can people who are at high risk of HIV infection, how soon can they get the treatment that they so deserve?
And Doctor, I'll leave this as a last question to you as I say goodbye as well. Right now, we're talking about how to manage HIV/AIDS once you have got it. I suppose really the takeaway from this has got to be that prevention is better than cure. That's got to be the takeaway message. And I ask this because twice now you've said, and I'm not arguing, that it's young women and young girls and women that are most at risk. But they can't do this by themselves. Men are also involved in this. There's got to be a conversation around how men are treating women and treating sexuality in our country, especially with young women.
Yeah. Gareth, you're spot on, and hence one of these discussions would be, we've been investing a lot in men, and so we have some of the speakers who are coming back to say, so now that we've told you that this is a problem, what is the return on investment as far as educating men on HIV is concerned? How are men responding to the epidemic as well? So, and also part of the messaging, we have one of the tracks at the conference is youth and HIV, and we're bringing both girls and young men to the platform to also talk about what it is that they will be doing to contribute towards ending the epidemic.
Yeah, and how they take that message back to young boys and young men in their communities as well. Doctor, I appreciate your time. All the best for the 11th South African AIDS Conference at the Durban ICC from tomorrow until the 23rd. I'm sorry, I said 2 days. It's actually 3 days. My apologies for getting that wrong. Starting tomorrow. My thanks to the SA AIDS Conference co-chair. You're going to hear a lot from Dr. Gloria Maimela at the conference, and I certainly hope to touch base with her again afterwards.